I'm a doctor of physical therapy, and I've got 2 minutes to help you with your sciatic pain. Sciatica is defined as inflammation or irritation to the sciatic nerve, which can occur at the low back in the lumbar spine or anywhere along the nerve tract, sometimes common in the glute. In the lumbar spine, the sciatic nerve has nerve root origins from L4, L5, S1, S2, and S3. Now, this is just fancy terminology where the sciatic nerve roots exit from the lower lumbar spine vertebral segments in the sacrum. One method of sciatic nerve irritation is due to a disc herniation. Now, this is a disc, a vertebral joint. You have the nucleus pulposus in the middle, and then you have the annulus fibrosus that surrounds it. With a herniated disc, this nucleus pulposus will actually push through the annulus fibrosus and impinge on these nerve roots of the sciatic nerve. Now, this causes irritation down the leg. Common symptoms of sciatica include numbness, tingling, burning, itching, or electrical pain. Another theory for lumbar spine origins for sciatica is just due to generalized instability. So you have some smaller muscles that act to stabilize the spine. And the thought process is that if these muscles aren't functioning properly, you can actually have some narrowing of the foramen where these nerves exit, and this can cause some irritation of the sciatic nerve and elicit sciatic nerve symptoms. The last main theory for sciatic nerve irritation is muscular in origin from this piriformis muscle. The sciatic nerve in each individual runs around or through the piriformis muscle, and it's thought that if this muscle is weak or potentially stretched or in some form compressing upon the sciatic nerve, this can elicit sciatic nerve symptoms. Treatment of sciatica involves calming things down. This can be done with manual techniques such as soft tissue work, foam rolling, the use of a lacrosse ball, a therapist, or other modalities just to decrease muscle tightness, decrease pain through neural modulation, and hopefully induce some blood flow, which may help with. Now, much like anything, I'm a big believer that manual therapy is not a remedy for these types of conditions. It can help decrease pain, but so can other things such as ibuprofen, a warm bath, or even some guided meditation. So what are we gonna do? We need to progressively strengthen, we need to progressively mobilize, and we need to progressively add stimulus to your body so that it can adapt so that this condition is no longer present. So let's go over that. After things are somewhat calmed down in the acute or subacute phase, I'm adding in nerve glides. I'm starting with variations that are less provocative for individuals, and there are certain variations that I prefer. Typically in the supine position on your back. You can also do some seated variations. And then after you actually start to mobilize